Polycystic ovarian syndrome is one of the most common hormonal disorders in women today, closely associated to developing many other health conditions, including infertility, type 2 diabetes, depression, endometrial cancer, and much more. So in today's video, I'm going to reveal the risk factors for PCOS and how you can treat it naturally and effectively. Hey guys, Dr. Gus here, naturopath, acupuncturist, conventional doctor, and founder of drlandivar.com. In this channel, as a conventional doctor, I treat my patients through natural medicine before recurring to the use of pharmaceutical drugs. So if you're new to my channel, consider subscribing and press that bell down below to receive notifications and be the first one to watch a new video. If you need to line an appointment or quality supplements for your disease, visit drlandivar.com. And I encourage you to stay till the end of this video, where I'm going to share extra tips and video links related to this topic. Polycystic ovarian syndrome is one of the most common hormonal imbalances affecting women today, and surprisingly enough, is often characterized by insulin resistance. What's most impressive and very worrying is that 72% of women with PCOS end up experiencing infertility. And if this were not enough already, PCOS is also associated with an increased risk of developing considerable amounts of health conditions, including, for example, high blood pressure, high cholesterol, mood disorders, a fatty liver, all of which are tied to hormone imbalances that turn out difficult to control. So in today's video, I'm going to reveal the risk factors for PCOS and how you can treat it naturally and effectively. Part 1, the risk factors and how to avoid them. If you want a good natural treatment plan for PCOS, it's important to understand that there are risk factors identified through research that need to be avoided. Avoiding risk factors is 50% of your treatment. The exact cause of PCOS is still somewhat unclear, but there are a few other theories on how it develops, and it's believed that several risk factors interact with each other to initiate the development of this disease. Some of these risk factors include, for example, insulin resistance, which to a certain extent can be preventable with exercise and lifestyle changes, smoking, obesity, metabolic syndrome, which again, all of which can be preventable to a certain extent. Another one is excessive alcohol consumption, or a genetic predisposition, which can be detected through diagnosis. Premature puberty and altered action of the luteinizing hormone. A sedentary lifestyle or a family history of PCOS are also very important. As you can see, many of these risk factors can be managed through lifestyle changes, diet and exercise, among other practices. Other risk factors, not so much. But the truth is, this condition can be greatly benefited with this natural treatment I'm about to reveal. Part 2, natural treatments. Number 1, supplements. There are several supplements that have been proven very helpful in treating polycystic ovarian syndrome. Over 900 studies have confirmed their efficacy. So I'm going to go over a few of them. But if you need a quality supplement for your condition, visit drlandivar.com. Inositol. If you haven't heard about Inositol before, it's a must. These are a group of 9 naturally occurring vitamin-like compounds that are present in many foods: myo-inositol, dichiro-inositol, and a couple others very useful in PCOS syndrome. Hundreds of papers published in the scientific literature have proven their efficacy to treat this condition, and supplements that treat this problem all contain inositol. Zinc. We underestimate zinc sometimes, but zinc is one of the essential 24 micronutrients needed for the body to work properly. It has antioxidant and enzyme regulating behaviors that affects several PCOS-related symptoms, including, for example, ovulation, acne, weight management, insulin sensitivity, and the regulation of blood glucose levels in the blood. Very important. Curcumin. Curcumin is a fabulous supplement that helps cope with inflammation. And in case you don't know this already, chronic inflammation or chronic low-grade inflammation is one of the distinctive characteristics in PCOS, responsible for many of the unwanted symptoms like weight gain, cardiovascular disease risk, infertility, hirsutism, and acne. So remember, curcumin. Fish oil. Fish oil is a great anti-inflammatory supplement and rich in omega-3 fatty acids that help relieve the condition associated with polycystic ovarian syndrome. Studies show how fish oil can reduce the levels of cholesterol, triglycerides, and blood pressure, lowering obviously the chances of a heart attack, stroke, or any other cardiac event that women with PCOS are at increased risk of having. It also has been shown to reduce period pains, insulin resistance, and improves your mood. So remember, fish oil. Number 2, change your diet. Modern day diet offers little nutrition, especially for women suffering from PCOS. But there are other diets, other models that have proven very effective in treating this condition. The best diets for PCOS are those anti-inflammatory diets with low carbohydrate intakes and diets that improve insulin sensitivity. Eating healing foods can be transformative. So here's a breakdown of those anti-inflammatory foods that should be a part of your daily table to prevent or treat PCOS. Healthy fats. Healthy fats provide important vitamins and minerals that boost those energy levels and your mood. Eating healthy fats helps prevent free radical damage, premature aging, and balances out your hormones. So foods like coconut oil, extra virgin olive oil, avocados, grass-fed butter, walnuts, or even flax seeds. Fruits and vegetables. This is not new to anyone. Fruits and vegetables are incredibly good for increasing the vital nutrients in your body and support your mood. They're high in folate, for example, which promotes the body's metabolic processes and increases insulin sensitivity. Some of the top foods include beets, broccoli, spinach, asparagus, and avocados. And to this, you can add some antioxidant foods to combat biochemical changes that happen during stress, for example, like blueberries, goji berries, blackberries, cranberries, and artichokes. Lean protein. Eating protein is critical to balance out hormones. The best sources of protein include grass-fed beef, wild fish, organic chicken, black beans, and even organic eggs, etc. This type of diet seems to reduce some of the metabolic symptoms of PCOS and results in weight loss. As a matter of fact, any lifestyle modifying diet that effectively allows a patient with PCOS to lose weight is going to have some benefit in restoring fertility and improving symptoms of this condition. So remember that it's always best to see some weight loss happening. Number 3, avoid endocrine disruptors. This is very important, so pay close attention. What are endocrine disruptors? These are substances that interfere with the production, release, transport, metabolism, or the elimination of the body's own natural hormones. And this is very important. Women with hormonal disorders like PCOS are very sensitive to this type of interference. And high levels of endocrine disruptors such as bisphenol A, pesticides, phytoestrogens can make and have an impact on those androgen levels. Endocrine disruptors can be found in many everyday products, including certain foods, toys, cosmetics, very important, plastic bottles, metal food cans, detergents, etc. So try to stay away from any substance that is not a pure natural form that you can eat or products that you can use, organic, unprocessed products. These are very important. Number 4, quality sleep. People have no idea how important sleep can become. There are even cancers that arise from sleep deprivation. Sleep is crucial for hormone production, cell regeneration, stress control, and even weight management. According to a study, women who suffer from PCOS that get less hours of sleep are at more risk of insulin resistance and mental issues. Not sleeping well can increase stress hormones in the body and change those hormone levels that control your weight and appetite. These include insulin, very important in PCOS obviously, and ghrelin for metabolism control. In synthesis, the more stressed out you are, the more sleep you need. Some women with polycystic ovarian syndrome may need more than 9 hours of sleep per day, so pay attention. Number 5, exercise. Exercise influences and balances out hormones, but has to be done in moderate doses. So walking, jogging, swimming, or even doing some weight training, but always in moderate doses. There's scientific evidence that says that no matter the type of exercise you choose, PCOS might improve fertility markers, insulin resistance and inflammation, and even weight loss with exercise. Help out the channel by giving this video a thumbs up and sharing it with your friends and family. And if you have any questions, leave your comments down below and I'll be happy to assist you. If you need quality supplements for your disease or an online appointment, visit drlandivar.com. And right over here, I suggest you check out these other videos related to this topic. You're going to find valuable information that might prevent a serious health condition in the future. Thanks for watching, you guys, and I'll see you soon.